Remember, nothing discussed or talked about on Dr. Langlois Live is meant in any way to diagnose or treat a specific problem or ailment in your own pet. Only your veterinarian can do that after careful examination of your pet. So if you do have any concerns about the health of your pet, why not give your local and trusted vet a call and schedule an appointment today? And now, on with the show. All right, good evening, everybody, and happy spring. There is a foot of snow on the ground here in Pennsylvania, and of course, why would it be any other way? This is Dr. Langlois Live. I am Dr. Bryan Langlois of the Pet Pantry of Lancaster County, along with also the president-elect of the Pennsylvania Veterinary Medical Association. I do apologize if the audio sounds a little weird. I'm hopefully making sure this is working right. If you guys do notice anything weird with the audio, please let me know in the comment section. I am trying to figure out why it is not working as well as I would like, but hopefully it's working good enough now. So, as I said, there's a foot of snow on the ground, and it is the first full day of spring. So why not talk about anything else but spring type things for your pets? And I will take 2 seconds here, just obviously with the snow on the ground and all that stuff, to rehash a little bit about cold weather tips. Obviously, if your pet is a shorter coated breed, you definitely want to take them out for shorter walks, have jackets on, things like that. People will be using ice melters and things like that on their stoops and the sidewalks. Really just a good idea to wipe off your pet's paws after they come in from something like that. For a couple of reasons. One, it can be a little caustic sometimes to the paws themselves, can cause some irritation. But also, a lot of those are in the same class as kind of Epsom salts. And while we do use Epsom salts, obviously, as soaks to heal things, one thing that Epsom salts are also used for is as a laxative. So if your pet does lick a lot of those types of salts off, you may notice them having to use the restroom just a little bit more. So that's why we also want to make sure that they get their paws cleaned and things like that. But again, hopefully the snow will be gone in a couple of days. It was kind of a freak spring snowstorm, probably something we won't see for many years to come. So, just follow, good logic when it comes to cold weather tips with your pet and things like that. And there's plenty of resources out there for it. However, we are going to talk all about the things that we worry about in spring and summer with your pets and all of those fun little things. But first, I want you guys to think a little bit about this, and we are going to talk more about it towards the end of the show. It's time for Dr. Vet Trivia, where we find out just how much you know about your pet's health. This month's question: if you find fleas or ticks on your dog or cat, what other parasite must you make sure you have your vet treat for as well? Think about it, and we'll be back a little bit later in the show with the answer. All right, so think about that as we talk about multiple things here. And the first thing that we're going to talk about really is heartworm disease. And it is something, obviously, it's really a good idea to have your pets on preventative year-round. You wouldn't know it by looking outside right now, but especially areas here in the Northeast, we are not having as cold of winters as we normally have. Again, probably the worst day of the year to possibly try to talk about something like this, considering the weather, at least outside in Pennsylvania and the Northeast right now. But it is becoming more of an issue, and we are seeing a couple of more cases a year pop up with heartworm disease. And it's really something, again, that is 100% preventable. What's really interesting about this show is that we're going to talk about a whole bunch of things that are 100% preventable. And they're not super expensive to get these preventatives. And it's a lot more money if you have to treat some of the side effects that we see going on with some of these things. So the first thing we're going to talk about here a little bit is heartworm. And I'm going to pull up, hopefully here, if this works right. Let's see. Okay, so now we're back. Once again, there's always technological blunders when I do this show. But what you are looking at here, as I clear that little back layer, is the kind of the prevalence, as we like to call it, of heartworm disease as it's been tracked through the years through the American Heartworm Society. And as you'll notice, I realize the maps are a little bit smaller, but a lot of these areas of very darkened red are high numbers of cases of canine heartworm disease that have been diagnosed. And with the exception of that little anomaly in 2010, and I'm not quite sure what was going on there, you can notice that you're seeing more and more areas of darker red creeping more and more northward, which means that we are seeing more cases of heartworm, especially in this area in Pennsylvania and other areas as well. So it's very, very important to remember all that stuff, and this is why we talk about these things so much here. Let me just pull back here to back there. So the next question is, how exactly does my dog get heartworm? And it is spread through mosquitoes, but I want everybody to understand at least a little bit of what is going on here with. There we go. Okay, there we go. So this is kind of showing just a quick little diagram of the life cycle of the heartworm. And I know this can be very boring stuff. I'm going to show you something much more interesting in a minute or two that hopefully will be the drive home impetus to go ahead and get your pet on heartworm prevention. But obviously, you have to have a dog first that is infected with heartworm. A mosquito will come along and bite and suck the blood of that infected dog. And circulating in that infected dog are tiny, tiny, tiny little baby worms that we like to call microfilariae, and which is kind of just like what we call a larval stage of the worm. So kind of an immature stage of the worm. And they go through multiple stages of maturation. So once they get into the mosquito, our good old mosquito friend here, they do actually kind of go through a couple of stages of maturation, and then that mosquito goes along and bites another dog and then actually transmits some of those more mature larvae now, which are a different stage, into the dog. And then over the next 6 months or so, your dog will develop heartworm disease. The worms will mature further and then eventually lodge, not necessarily in the heart. And that's actually a very interesting thing, is it's not necessarily a true misnomer per se, but it is something that, we do tell people. It really does actually cause a lot more lung problems and can potentially lead to fatal heart disease, which I'm going to show a video of here in a second. But you do have to be aware that these things are very serious. And since it does take up to 6 months for the adult worms to, kind of propagate and mature and then cause the problems they do, this is why preventative is so important. Because if you just have your dog on monthly preventative, there's no way really, unless there's a product failure or something like that, that your dog can become infected with heartworm. And, the treatment for heartworm is very, very dicey. Actually going back to the old days, we actually used to use arsenic of all things to treat heartworm in dogs. And it was effective, but obviously, you're dealing with a poison itself. So you've got to really be careful exactly how much you're giving. We do use a slightly safer medication nowadays, but there's a lot of risk involved in treating heartworm. And obviously, you would have to talk to your veterinarian if your dog did come back positive for heartworm as to what treatment course is best for your in particular animal. There's really no one size fits all to this. Every treatment plan is a little bit different. Every treatment plan is a little bit kind of tailored to your own particular dog, how long they've been infected, are there any secondary problems as far as heart changes, are there lung changes. So there'll be a lot of different things that are done if your dog is found to be infected with heartworm. And there's going to be probably some staging that goes on, what they call it, where they're going to be taking some x-rays of their chest, they're going to be checking their lungs. They might do an echocardiogram or a sonogram of the heart as well, all the way up to, if your dog is severely, severely infected, to a condition called cor pulmonale, which is a life-threatening condition. And I'm going to show a video of what has to be done in that situation, basically to save your dog's life. All of these things that are done to stage and then treat, and it's a treatment that lasts, or a treatment protocol that lasts for many months. All of these things cost money. And it's a lot more expensive to treat a dog for heartworm than it is just to buy the monthly preventative. It's also really important that you still have your dog tested for heartworm every year. And I know a lot of people say, well, I'm keeping my dog on heartworm prevention all year. Why do I need to test all the time? A couple of reasons. One, there have been cases, they've been rare, of product failure, where the product just did not work as well as it was supposed to. And in those cases where you have the proof that the dog was getting the medication on a monthly basis and it didn't work, the company often will reimburse and pay for all of the cost of treating your heartworm positive dog. So that's one reason right there. The second is the treatment protocols, as I said, vary. So if for some reason your dog does all of a sudden become positive for heartworm, your vet's going to want to know that because it's going to change the way that they use that preventative. And again, these are all things that you have to talk to your vet about. So it's all really important that, you remember all these things kind of in the back of your head. Hopefully your dog will never be positive for heartworm. And we start them right when they're puppies, with their first couple of doses. Usually we will not test them as puppies because it does take a full 6 months for the worms to mature once they are in your dog. And so we won't be able to pick up anything on a test until that 6-month mark. So if we start the puppies early, usually it's not until their yearly checkup after that that we actually do start testing for heartworm and, Lyme, and are looking at a whole bunch of others that go into that one simple little test. So that's really important to remember with heartworm. Now, if everything I've said doesn't strike you yet, and it's very possible that it doesn't, because a lot of people are like, I still don't need it, it's not really that prevalent up here, I'm not seeing a lot of cases, none of my friends seem to have it and they don't treat their dogs, and I don't want to give my dog a pill every month, and all of these things, because you really think the risk is not too much there. I'm going to show you guys a video of what has to be done if your dog is severely infected with heartworm. And hopefully this will drive it home as to why you truly need to get your dogs on preventative every month throughout the year.
Good girl, Coco. Come on.
All right, so As I said, if nothing else convinces you to get your pet on heartworm prevention, I hope that video does. Those are dozens and dozens of worms that are actually, what they were doing there was they were actually accessing the jugular vein, and that's the way you got to do it. And then snaking that instrument down through the jugular vein, almost right to where the heart is, the base of the heart, and basically extracting the worms, because at that point the worms have created a life-threatening condition for that dog where the heart will not be able to beat properly, and the dog is going to go basically into heart failure. It's an emergency procedure. It's thousands and thousands of dollars to have done. The treatment for a heartworm dog that is not into that stage is hundreds, if not thousands of dollars as well. So factor that in. 10, 15 bucks a month maybe for heartworm prevention versus thousands and thousands of dollars to have to treat it. Ounce of prevention worth a pound of cure. I can't describe it any better than that in that situation. So please get your pets on heartworm prevention. Talk to your vet. Get them tested every year because it really is vital to their health. And like I said, you know, the maps don't lie and the data doesn't lie. We are seeing more cases of it creep further and further north as we are getting warmer and warmer winters. And again, worst day of the year to try to demonstrate this in the Northeast, but we are getting warmer winters and we're not getting the deep freezes that we used to. So, you know, the mosquitoes are surviving longer. We're seeing more of them. And we, especially with dogs transporting up from the south a lot now, too, in rescue situations, you have a whole reservoir. I can guarantee you down in the south, they see heartworm positive dogs day in and day out. When those dogs are transported up north, they are a new reservoir of potential heartworm infection for dogs that maybe would be naive and not even travel. So definitely, definitely, definitely get your dogs on heartworm prevention. And I hope that video drove that point home because I don't want to see anybody's dog have to go through that as far as that goes. So now we're going to talk a little bit about fleas and ticks. We're going to start with ticks. And the big thing that everybody worries about with ticks, obviously, a lot of times is, aside from the fact that they're just, you know, annoying little creatures and that, you know, they're bloodsuckers and they can be seen everywhere and all over the dog and they can be a pain to remove, things like that. The big thing, obviously, that we also worry about with ticks is disease transmission. And we're seeing more cases of what we call tick-borne diseases appear in dogs. Basically, obviously, the big one that everybody is aware of is Lyme disease. And it's not just the deer tick now that can transmit Lyme. There are other types of ticks out there that transmit Lyme disease. So just because you think you may not have a deer tick on your dog or find one doesn't mean that if you find another type of tick that it could not potentially transmit Lyme disease. And again, that's the big thing that I try to drive home with everybody is that we're seeing Lyme disease much more. I'm going to throw a little graphic up here to show kind of the hotbed of areas here as soon as I kind of clear this out. Give me 1 second. So we're going to show this little lovely map. And basically, this was a forecasted projection put out by the Companion Animal Parasite Council, which is really kind of considered the top dog when it comes to you know, these types of things. And I can tell you that from talking to people and reading up some of the other stuff, that map is pretty spot on. And you could see that whole Northeast area where we are in Pennsylvania and Northeast, that is red hot with tons and tons of cases. And I can tell you that I see cases maybe once a week, and these are just in rescue dogs that come through, you know, through the rescues that are saved and brought in from just even local areas. So we're not talking about dogs that have traveled and then come back and things like that. So they definitely are all around. And I'm going to throw up another stat here real quick, put out by that same group. Let's pull that in. There we go. You know, 1 out of 15 dogs in the U.S. is tested positive for canine Lyme disease. And the one thing, you know, you have to be aware of is that, again, just like when we were talking in heartworm, every case of Lyme disease can be a little bit unique, just like every case of heartworm disease is. And you have to talk to your veterinarian about what the best treatment options and further diagnostics are. A lot of times we pick up Lyme disease positive dogs on routine screenings, and this is why getting your pet tested for heartworm and Lyme disease every year is vital. And there's some debate in the veterinary profession right now, I'm not going to lie about that, as to do you treat every heartworm positive or every Lyme positive dog, or do you do further testing to look to see, is it potential just exposure? Is it an active infection? And these are all things that you need to talk to your vet about. Most of the time, these cases still are going to be treated. As I said, there's some debate in the veterinary profession, so you're going to read about that if you research some of this online, as far as my dog just came up Lyme positive, but he's not symptomatic, he or she's not symptomatic. Do I still need to treat? And the jury's out a little bit on that, but it's something you need to discuss with your veterinarian. My personal opinion is I don't think we have a good enough way of differentiating some of these cases yet. And we're going to talk a little bit in a second about what some of the more chronic signs of it are. So I'm more inclined to still go ahead and treat. Every vet's a little bit different, though, and every vet has a different treatment protocol that they sometimes bring out for these things. So if your dog does turn up Lyme positive, and especially if you have a dog that is going to be out in the woods, out in the brush, areas like that, you definitely want to make sure that they get tested for Lyme every year. And you may also want to talk to your veterinarian about getting them vaccinated for Lyme. Again, it's the Lyme vaccine, as we talked about in the first show in January, it's not considered a core vaccine, which basically means that it's not something we're going to give to every dog in every situation. If you have a dog that just basically spends all their time in an apartment, never really goes outside much except to pee and poop, and then comes right back in and it's not really exposed to brush or areas where there's ticks, probably don't need the Lyme vaccine. But, if you have a dog that likes to go hiking with you or hunting, or just as, you're up against a forest type property, you are definitely going to want to talk to your vet about getting the Lyme vaccine. Now, if you happen to find a tick on your dog, or if you're concerned about Lyme disease, what we recommend is not having them tested right away. If you happen to be able to get the tick off, you actually can bring it into your vet. Sometimes they can send it off to have the tick actually examined to see if there was presence of Lyme disease in that tick. But otherwise, if you try to test them right away, the body has not had a chance really to respond to the infection where you're going to get a positive test. So usually we recommend to people waiting a couple of weeks and then potentially having the dog tested. You're also a lot of times not going to see that classic bullseye rash that we see in people with potential Lyme infection. And there's two reasons for that. One, our dogs are mostly fur, so we're not even really going to notice it, if it first happens. And two, we don't see it in every case. It's kind of, hit or miss sometimes where we'll see it, we're not. And if it is there and we miss it or it just doesn't show up, there's really no other signs that kind of go on with this sort of thing. We just kind of have to see how the dog does. And it's usually we don't pick it up until later, either on a regular screening test or if your dog starts showing some of these signs. And I'm going to pull that up right now as far as potential signs of Lyme's disease. And this is just something, you can search these. These are all over the place. So the biggest thing we often see with Lyme disease in dogs is lameness. And it's usually a lameness that shifts legs. And this is because the bacteria that causes Lyme disease actually can cause some inflammation in the joints. So one day he or she might seem a little bit lame on one leg, and all of a sudden 2 days later they appear to be lame or sore on the other leg. That's a tip off to us that sometimes there may be Lyme disease going on. Sometimes if they're just overall stiff and painful and not as active as they used to be, that sometimes can be a tip off that they are suffering from a little bit of Lyme disease infection. Difficulty breathing, that's a little bit lower on the list. I wouldn't necessarily jump right to Lyme on that, but obviously if your dog has difficulty breathing, you definitely want to have them seen by a vet anyway. Just general malaise, things like that. Sometimes lymph node enlargement, but again, those are lower on the list. The big thing that we normally see with Lyme disease in dogs is lameness. It's the biggest one out there, and it's one of the first things that we test for. So it's basically the big thing that we look for in these guys. And if we do see it, a lot of times the disease has progressed a little bit, again, because we weren't necessarily looking for it or we didn't pick it up on a screening test. So then you just have to go ahead and treat it. It is very treatable. It's very hard to eradicate from the dog. So sometimes you will see recurrent flares and things like that. And, your vet will talk to you a little bit about further possible complications, either involving their kidneys or their heart. Again, things that don't happen very often, but things that you do have to be aware about and potentially look for. So if your dog is Lyme positive, your vet may actually recommend checking their urine, maybe twice a year, just looking for any sign if there's any protein leakage into the urine. It's important to talk to your vet about that because some dogs can develop what we call a Lyme nephritis, where their kidneys get severely inflamed. And, that's a much more serious condition, things like that. Occasionally, if it does go on to really become a problem with them, we do see other problems with neurologic issues or cardiac issues. But I would say, 90 to 95% of the times when we're going to suspect Lyme, it's going to be because we're going to see lameness in the dog, and you're going to notice the dog is limping and appears uncomfortable. So definitely something to talk to your vet about. Definitely something you want to make sure that your vet is aware of where your dog goes, if the ticks have been pulled off, things like that. Because there are other diseases as well, not so much in this area in Pennsylvania, but certainly more Midwest or out west or down south, things like Ehrlichia or Anaplasma, which are more red blood cell type parasites that can cause anemia and some other diseases and things like that. So, you definitely want to talk to your vet, especially if your dog travels a lot and all of a sudden is showing some off signs. definitely something your vet's probably going to want to test for. And again, treating these things is more expensive than just doing the yearly test or testing. So again, 100% preventable, and definitely preventable with good flea and tick prevention, which we're going to talk about at the end of the show. So that's ticks. The final thing we're going to talk about is fleas and some problems that can be developed from fleas. And basically, the biggest thing that we worry about with fleas are a couple of things. One, they can transmit certain diseases, especially more in cats. We worry about some red blood cell parasites and things like that that can cause anemia and some illness in cats. So, you definitely want to be aware of that. Your vet may look at kind of testing for some of those. The big thing, and I'm going to pull it up here if it will let me in a second, is, let's clear that. Let's bring that out. And this is classic. Okay, sound back. This is what we call classic flea allergy dermatitis, and this occurs when a dog is infected with fleas, and usually you're going to see a lot of scaling, a lot of itchiness. They're going to be biting constantly at their tail base because that's just where the fleas tend to congregate, and it can spread through the entire dog. So this is something if we see a dog with this type of presentation, the first thing we think of is fleas, flat out, nothing more, nothing less. And we'll check for that first, and we'll even try to treat. And sometimes you may not even see a flea on your pet, but your pet is still suffering from a flea allergy dermatitis. And here is the reason why that is the case. What a lot of people don't realize is it's the saliva of the flea that the dog's skin is reacting to. It's not the flea itself. And for severely allergic dogs, it can be one flea bite that sets them off. Same thing in cats. We do see this in dogs and in cats. Cats don't read the book on anything. I'm just going to say that, and you'll hear me say that multiple times. They just do what they want. And so we do see kind of sometimes scabs all over them, tiny little scabs that feel almost like millet seeds on them, or they can present with the normal way at the tail base of having some hair loss and a lot of itchiness, things like that. So we have to make sure that we do obviously treat that because it is an allergic reaction, and we will treat it probably with some steroids and some antibiotics to calm the skin down. But prevention, again, is the key. We have to be able to make sure that the fleas do not get on your pet. And flea prevention is something that is more than just treating your pet once a month. And I'm going to talk about topicals versus baths and all of that stuff in a second. But it is something where it's an environmental treatment. So just putting a spot on your pet and thinking that's going to take care of everything is not necessarily going to cure your flea problem. I can guarantee you that the fleas are not only on your pet, they're on your other pets as well. So we've got to treat all of them. They're in your home. They're on your furniture. They may be on you if it's a really heavy infestation. So you've got to do a lot of, really heavy duty cleaning and vacuuming and things like that, and just making sure that you keep up with it. And you can get ahead of this and you can control these things, but it's not going to be a once and done thing. They are going to have to be on flea and tick prevention year round. And the same thing as heartworm prevention. Because again, we are not having the real cold die-off winters that we used to in the Northeast. Obviously, if you're in the South or the Midwest, somewhere like there where, it doesn't really get too cold at all, you're going to be on them year-round anyway, because it's just a year-round life cycle that goes on. So those are all really important things to kind of remember when it comes to flea control, and you can talk to your veterinarian about all of that stuff. And we're going to talk a little bit more about it in a second. But first, let me clear this again. We are going to look at the answer to that question because it does bring me up to another important point of something else you need to be aware of if your pet is infected with fleas. So let me just make sure this is set, and here we go. All right, time for the answer to Doc's Vet Trivia. Earlier in the show, we asked you, what other parasite must you make sure your animal is treated for if they're found to have fleas? Well, if you said our buddy the tapeworm, you were correct. As an aside, did you know that some supermodels actually would intentionally infect themselves with tapeworms to lose weight before a show? Not sure I'd follow that diet plan. So, what do you think of that, huh? Like I said, not a diet trick that I would use, but it has been shown to be done by supermodels to lose weight. But yes, tapeworms are a very, very important thing. And I'm going to pull up exactly another thing that is usually a misconception with this. So you do need to definitely talk to your veterinarian about these tapeworms and what can happen. And let me just clear that, and we will clear this. I love doing my own audiovisual work here as I try to explain things. There we go. We just got to get the audio up on that. Now we're good. Okay. So what's interesting about it's not from the flea biting the dog that they get ingested with tapeworm. It's actually them ingesting the flea itself when they're grooming it off that has the tapeworm larvae in there. And that kind of propagates the life cycle, and then your dog gets tapeworm. So what we recommend to everybody who does have a dog or a cat that is infected with fleas is that they also talk to their vet about being treated for tapeworm. And if for those of you that are wondering, because we do get this question as well, as I'm going to just pull this up here in a second, what does tapeworm look like? Well, it's very rare that you're actually going to see the entire tapeworm segment. Instead, you're going to see actually tiny little segments, and it's going to look like this. I apologize if you're eating, but this is what it looks like. Little tiny movable rice kernel type things on your dog or cat's poop or around their butt. And that is a clear-cut sign that they are infected with tapeworm. You really do need to talk to your vet about getting good medication from your veterinarian to treat tapeworm. There are some over-the-counter products out there. They're not as reliable as the thing that you can get from your veterinarian to go ahead and treat it. So you definitely want to talk to them about the best drug out there to go ahead and treat. So that brings us to the final thing that we are going to talk about when it comes to flea, tick, and heartworm prevention, and that is flea and tick prevention itself, as I try to bring everything back here. And we're going to talk about two quick things, and then I will let everybody go on this wonderful morning or evening. There we go. So there is a difference out there in flea and tick prevention, and I'm going to say two things on this. The first is any over-the-counter flea or tick prevention product that you get, you have to be a little wary of because they are not coming directly from a veterinarian. And, a lot of times the companies won't even back them because we don't know the shipping. We can't guarantee that the chain of custody was perfect. So your veterinarian really still is the best place to get these flea and tick preventions. And there are new ones that have come out on the market recently that really are great products. One is called Activil. One is called Brevecto. There's a couple of others out there that are, month-long or 3-month-long products, but you can only get them from your veterinarian. And I know everybody says, I don't want to go to my vet. Trust me, you want to go to your veterinarian for this and get it from your veterinarian because they will back the product. The company will back the product if it doesn't work that way. You are not going to get that kind of guarantee if you try to get it just over the counter somewhere. I realize it's cheaper. I understand the price pressures on these things, but really, especially if you have a dog or a cat that is really sensitive to fleas or ticks, these are the best products out there, and they can only be gotten at your veterinarian. Don't accept cheap knockoffs. Don't try to get some of these things over the internet. I can guarantee you they're not the same product. There's been time and time again where they've proven that these things are not even close to the same product and the packaging isn't even the same. So, people are just getting duped out of this and really just talk to your veterinarian about the best products that are out there for flea and tick prevention. So that's one thing. The second now is the difference between what we call knockdown products and products that are really designed as spot-ons or longer acting. The knockdown products are things like your shampoos and your powders and your sprays. They're really good at killing the fleas that are currently on the dog. However, as soon as you take that powder and off or rinse that shampoo away, all that stuff, the efficacy of the product is gone. It doesn't work anymore. So basically, any fleas that are in the environment, they're just going to jump right back onto the dog or cat, and the whole thing is going to start again. As compared to the spot-ons, which usually come looking like this, or various forms of these types of things, and these are the oils type products that you actually do put on the back of your pet, usually along the back or just in between the shoulder blades on the skin. These are residual activity products, and they can last up to 3 months depending on the product that you're using. Most of them are still around a month to 6 weeks. These are the commonly things you hear about: Advantage, Frontline, Activil, Brevecto comes in a spot-on for cats. Vectra, all of these different types of products are spot-ons that do have that residual activity. It spreads through the skin and so will kill the fleas and ticks, when they jump on. What's nice about some of the products, and again, you've got to talk to your vet about this, is some of these spot-on products work differently. So some of them, the flea still has to actually bite, or the tick has to bite to uptake the preventative, and then they'll die off. That's a problem, as we've said, for dogs or cats that might be prone to flea allergy dermatitis. Then you want to talk to your vet about potentially a different type of preventative that may have more contact kill on the flea or tick as compared to having them have to bite. But again, you have to talk to your vet about that because every case is a little bit different. But the spot-ons really are the way to go. The longer-acting ones are the way to go. For certain situations, if you've got a huge infestation of fleas or ticks, yes, certainly the shampoos can work, or the powders or the sprays, they can work. But again, you've got to be careful with that and follow the instructions on it and listen to your vet. The other thing that we worry about with fleas, especially in young puppies and kittens or severe infestations, is these are blood-sucking creatures, and you get a couple of thousand of them on a cat, and they are literally going to suck the cat dry. And we have seen really sad cases of cats die from lack of blood and severe anemia because of severe flea burden. So, again, 100% preventable. No reason why, any animal should have to suffer through that. So get your flea and tick preventative things. And the final thing that I'm going to talk about tonight when it comes to flea and tick prevention is this. And this is something that we see every year, and it is heartbreaking to see. There's going to be no sound on this video just because I can't voice over it. But what I want everybody to remember, if you take absolutely nothing away from this entire Dr. Langlois Live episode, check the label of every spot-on product that's designed for flea and tick prevention. If it says anywhere on it, and it sometimes will not say it in big letters, but they're getting better with the packaging, do not use on cats. Don't use it on cats. Don't try to get a big dog product and think you can split it between your cats to try to save money. Because a lot of times there's a product in there that is very toxic to cats and causes a really, really horrific muscle spasm type reaction that sometimes we cannot save cats from. And I'm going to show a video of that right now, so this way everybody can kind of see. Again, there's going to be no sound to this, and I apologize if people are a little disturbed by it. It's not too gruesome or anything, but it shows what a cat that is suffering from this reaction is going through, and we can only stop it with very powerful muscle relaxants, and sometimes even then it's too late. So please watch this and keep this in mind when anything like this might happen. And that just keeps going on until we can hopefully get the product off through a lot of baths and a lot of muscle relaxants to try to calm that spasm. That is not a seizure type activity. That the cat is aware of everything that's around it and stuff like that, whereas a true seizure is an unconscious event. This is solely on their musculature that is affected, and it just causes these constant twitching spasms that literally can kill a cat. I've seen it, and every year we see cases of this come in, and there's absolutely no reason for it. We do try to get on these manufacturers to make it much more obvious not to use it on cats. And sometimes we see these repeat offenders who still do it despite what happened to the cat the first time. And those are the worst of the worst cases to potentially see. But if you have any flea spot-on product in your house or tick preventative product, if it says don't use it on cats, heed the warning, because I don't want to see anybody's cat have to go through that and that type of setup. So, that is the biggest thing that I hope everybody takes away from this. Do not use dog flea products on cats. They can kill the cats. It can cause really horrific side effects, sometimes that are lasting for quite a while. So, and there's, again, 100% preventable. Everything we talked about tonight is 100% preventable. So with that, this episode of Dr. Langlois Live is going to end. Obviously, it will be archived on YouTube for anybody who could not actually catch it live. There was no mail for Doc's mailbag this week or this month, but if anybody does have a topic or a question that they would like covered, drop me a line at shelterdoc38@yahoo.com. Again, shelterdoc38@yahoo.com. I will research it for you and hopefully answer it on the next show. But hope everybody, if you are in the Northeast, you're doing okay, having safe travels, not really bogged down. It was an interesting day here at the Pantry because I was here all by myself since the snow was so bad. So, but hope everybody is staying warm. Hope that your pets are staying warm. And please make sure that you, heed all of the warnings. Get your pets on monthly flea and tick prevention. Get your pets on monthly heartworm prevention. I know there's a foot of snow on the ground right now. That's going to melt away quick. We are finally going to see a spring, I'm sure, at some point, and the fleas and ticks are going to be out, and the mosquitoes are going to be out, and your pets are going to be affected by them if you don't take the proper precaution. So with that, again, I wish everybody a most pleasant final few hours to the first day of spring. and we will see you next time on Dr. Langlois Live. Dr. Langlois Live is made possible in part through help from the Pennsylvania Veterinary Medical Association. For all the up-to-date information for your pet's health, check them out at pavma.org. Please consider supporting these organizations that are very important to Dr. Langlois. The first is the Pet Pantry of Lancaster County, meeting the need for animals and their families in Lancaster County. Visit petpantrylc.org. Second is Pennsylvania Racehorse Rehoming, Rehabilitation, and Rescue, providing that all-important second chance at a great second life and career for retired racehorses off the racetrack. PARacehorse.org.